Hi, welcome to The Line. You know, every day I get to just meet and talk to some people that are really revolutionizing the way we consume today. Not only business to business, but healthcare has just been this radical movement on how they're having to compete in this space. And Emily Tisdale right now with Recourse Resource is the founder, CEO, and chief consultant, bottle washer too, right? So we have a great guest on today who's really out there, built a business that sees a need that maybe even these healthcare providers don't even know that they have, but there's so much noise in this business within how they market and message. Emily, how did you get the idea to start this?
Well, I have to tell you, it's a story that I share with everybody, and anyone that's in healthcare has really related to Here Go Quit. And I started this 4 years ago officially, but I think the journey started in my head even before that. I was in the hospital sector and then senior living and all of the different sectors within healthcare for a number of years. And there was one instance when I was working for a startup senior living community on the west side of Indianapolis. And it was 6 months prior to opening and stomping the grounds, trying to develop relationships as a good director of marketing should do. And about 6 months later, we opened. 2 to 3 months later, we started to see the boom decline in referrals. So we did a great job at the outset. People started, referring to us like crazy.
Right.
Then all of a sudden, out of nowhere, referrals dropped. I had good relationships with my competitors, and we would joke around and say, "Did you take my referrals? Are you taking all the referrals this month?" Couldn't find the answer there, so I came tail between my legs to our primary referring hospital, to the discharge planner, and I asked her. I said, obviously we've done something to upset you. I hope that you'll let me know what it is so we can at least make it right. I mean, there was nothing else I could do.
Right.
And I never will ever forget the way she looked at me and she said, "Emily, we like you. We like all the things that you bring us. You call us on the spot. But at the end of the day, you don't take care of our patients and your nurses are terrible." And that was just kind of the nail on the coffin.
Right.
And in the world of healthcare marketing, when you're in that world, it's really a numbers game. It's the number of sales calls that you make that turn into referrals, that turn into admissions. And if one of those stops dropping, it's a downhill slide from there. So I thought, oh my gosh, my days are numbered, obviously. But there's nothing I could do about it because I had no jurisdiction over the internal staff.
Well, if I may, isn't that why your value proposition really, to understand how the message and the product and the service is all part of how you're going to market, how you're delivering value on that end. You can't talk about one without affecting the other. These are three legs to the same stool, and that's really what your value proposition is, if I may, right? That's what you're helping these healthcare providers get their head around and understand.
That's exactly right, Tony, and you put it so well. And so what happens is we talk a lot about what happens on the outside of the house has to coincide with what happens inside of the house. So we may look at marketing from one perspective, but what happens is it ends up being the patient experience, but the patient experience is also tied to employee engagement. And did we select them right from the outgo? Did we introduce them to our company and our culture the right way so we can have them deliver the promises that as a company we make? So it's very cyclical. It's all tied together, whether we want to see it or not. But like you were saying earlier, it's a problem that I think some organizations right now are starting to realize they have. They just haven't connected the dots yet.
Well, I would, one of the things that when I was just researching your company and trying to get my head around how pervasive this problem is in the healthcare space, one of the things that healthcare has is they've got all these different vendors managing all these different extensions of their business. And there's really no coordinated, delivery and methodology to their brand. It's just, it's disjointed at best. And that's one of the things you help these companies really get their head around, is how all these multiple touch points are affecting the experience of what they deliver. Is that fair?
Yes, you're right on. And so what happens in those situations is, like you said, we have to have coordinated care. It's called the continuum for a reason. And no matter how great you are at being, the rehab to home of choice, you only service that population, and you need to partner with other providers to make sure that that patient gets well, that we reduce readmissions. But what's difficult is even the hospitals, for example, have their own home health care. They have different subdivisions for healthcare. They can't all do it well. So in order to be able to partner right to meet patient outcomes, we have to make sure the experience and the engagement is all together and we set the precedence on what our patient needs.
Right.
So we have to partner with the right individuals. If you're a home care company, partnering with the right groups to be able to say, this is our philosophy, this is how we do things at X, Y, and Z Home Care, and these are the types of people we partner with.
So Emily, is home health your ideal client, or what does your ideal client look like right now?
That's a great question. So at Recourse Resource, we specifically focus on healthcare delivery organizations. So anyone that can claim that they have patients or clients, whatever the title may be, we help those healthcare delivery organizations to maximize opportunities.
And when they come to you, what is the pain that they say, we have this and we're dying, and we just hope you can help us fix them?
A lot of the terms that we hear a lot of is either our market share is down, our referrals are down. So those are often some keywords that we listen for. Also, our employee turnover is high, or our employee satisfaction surveys came back and our scores tanked. And they're not able to look at it and pinpoint the areas that they need to.
I just want to take a moment and chime on that. When you go and look at your guys' website and you speak to the value that you bring, a lot of people might think that you're trying to dip your hat in a lot of different buckets when you think about the fact that you're talking about training and you're talking about marketing and you're talking about customer experience. But those three things are so tightly tied together, and the companies that don't really realize that this culturalization of your business, how you're communicating your culture externally and internally, is one of the most important things you can market to. I mean, they really aren't getting that out of the gate, are they?
They're not, and so that's where that disconnect happens, is the fact that they just are not connecting the dots between what they are trying to say and what's actually being heard. So we say, oh, well, marketing must solve the problems, right? And it's always, marketing's our knee-jerk for everything, whether it's a good or bad reaction, it's our knee-jerk.
Right.
But there's so much into it that perpetuate either the good or the bad, that we have to connect those dots in order for all of the other pieces to be successful. So, for us, we got to get rid of the silos so we can create better systems. And that's what we help our clients do.
So Emily Tisdale is actually helping you as a provider design the customer experience that is going to get you not only the internal and the external stakeholders that are going to win for your practice, your healthcare provider. I mean, thanks for being on the show, Emily.
Thank you, Tony.